Welcome, friends. We have Dr. Ganesh Bokhare with us, and today it's a very interesting topic. We are talking about how, if you put it in very simple terms and not in really medical terms, when a patient goes into a hospital, what is the kind of treatment that he gets, and where all is he taken into? It's like a maze where all he's taken inside the hospital and made to do what all tests. So, is this a pattern for everybody? This is something that I have been discussing with Dr. Ganesh, and Dr. Ganesh also spoke about his experience. I also spoke about my experience, and there are many people who have been speaking about their experiences. This has become a pattern in big hospitals, and this is something that we are going to discuss tonight. Welcome, Dr. Ganesh. Yeah, friends, can you hear Dr. Ganesh? Is he audible? Can someone tell me, Ragi? Is Dr. Ganesh audible? Dr. Ganesh, can you say something? No, you're not audible, Dr. Ganesh. Can you come through your phone? Is it possible? You'll have to go out and come back again. Yeah. So I'm just waiting for Dr. Ganesh to join us. So, friends, what I wanted to speak about is this terrible mafia that seems to exist within hospitals and the connection between hospitals and doctors. Some very unscrupulous doctors, the connection between them and the hospitals. Yeah, Dr. Ganesh? Dr. Ganesh, can you speak?
Hello,
Yeah, we can hear you now. We can hear you.
am I audible?
Yeah, you're audible. Yes, you're audible. Yeah. So, what we
Can't
were
hear you.
saying, yeah, can you hear us? Can you hear us, Dr. Ganesh? Can you wear that? Can you
Hello.
wear your, can you wear your,
Now I can hear you.
yeah, okay. So, yeah, back to what we were saying to the viewers is that, see, there is a strange connect, when a patient goes to a hospital between the doctor and between, the hospital. There are some unscrupulous practices that are happening which are making us all go rather worried. Because let me just tell you a simple incident. I had an eye problem where I was seeing some sort of, moving visions on the sides of my eyes. And I went to see my eye doctor, very good specialist. And he told me that, see, he got me checked. We did my tests, everything. And then finally he said, there's nothing wrong with your eyes, but you need to see a neurologist, and also get an MRI done. So then I said, why an MRI? So he said, to make sure that the rest of your body is okay and your blood is flowing, properly. So this was something that really shocked me. So I went to the neurologist, and the neurologist said, you can do your MRI right now. So I told her, see, I have a problem because see, I'm not I'm not comfortable in enclosed spaces, and MRI is it's claustrophobic. So she said, no, no, you can get it done. They will give you a sedative, and you can take a sedative, and you can get it done today itself. So my husband and I, we looked at each other, and we decided it's time to run out of the hospital. You know, so we decided to move away. So we went away. Yeah. Similarly, Dr. Ganesh also, told me about his experience, and this is not only about Dr. Ganesh and about me. There are many people who are undergoing this in India, and this is a scam that has to be revealed and brought to book. Yes, Dr. Ganesh.
Thank you, Menaji. It is always a uh, pleasure to talk on your
Thank
show.
you. Thank you.
But last couple of weeks, I think we could not meet because of
Yes,
some
yes,
inevitable problems. Yeah.
yeah,
But uh, uh, before we jump into this topic, I received a couple of emails from your viewers. Okay, it is related to indirectly this topic. Okay, because our topic is mafia of this. You can say the doctors and the healthcare in India. That is the first part, and the second part is how to get rid of this, how to stay away from this, and how one can deploy the spiritual healing.
yeah.
So you can have a interaction with doctors with a bare minimum, you can say, efforts or bare minimum, you can say, uh, treatment from this allopathic or any or hospitalization, whatever is there. Okay, because we'll go in details of that. But there was a one viewer of yours, he was going to commit a suicide. This is a story just 2 weeks back.
My God,
I was shocked. Uh, uh, and that guy's, his name is Nityanand. I don't know whether he's right now online or not, but
what is the name?
2 weeks back he called me, yeah,
What is
and
the
he
name?
said, Nityanand.
Okay.
Okay, and he's from Pune only.
Mm.
And he said because of some COVID issues, they face a lot of business losses, and he was about to commit a suicide. He was totally frustrated, and when he saw your channel, Candid Meena channel, and when he saw our first couple of episodes, he that changed his mind. So
Oh,
how to live a life? Okay,
thank
spiritual.
God.
What a spiritual discussion we had in last couple of episodes. And then he said, I was so uh, means his mindset was so changed. He removed that concept of committing suicide, and now he's going to start a hotel business probably in a week time. And he
Oh,
said it
very
has
good.
encouraged me a lot. So saving one life
Hmm.
because of your show. Okay, it
Thanks to you.
it is much
Thanks to
more
you, Dr.
creditable.
Ganesh. Yeah.
Yeah. So that is a one incident. And second incident, there is a one madam Jayashri, her name is there. She sent me an
Yeah.
email today only. Okay, she's also your viewer, and she
Yeah.
was saying, "Where are you, Dr. Ganesh? Every Thursday we were looking for your show, and sometimes you are scolding us, but we consider it as a blessings for us
Yeah.
whenever you give us
Absolutely.
scolding."
Absolutely.
So that credit also, I think, it goes to your channel. So these are the two things, and
See,
it
Dr.
is
Ganesh,
indirectly
it
related
is
to the
not,
spiritual healing.
yeah, it's not only that, it's not that exactly. See, when very well, versed people like you are speaking and you connect everything to the spiritual path, it gives a lot of hope to people.
Right. So, so she today means just 2 hours back she sent me an email. So thank you for coming back to Candid Mina channel. There are some problems, inevitable problems, and so it happened. But the point is here, it is related to the today's topic, that the spiritual healing makes keeps you away from the doctor.
Yeah.
Okay. So there is a old proverb is there, no, apple a day keep a doctor away.
Yeah.
Okay.
So, friends,
So
before Dr. Ganesh continues, I just want to say something, okay?
yeah.
Dr.
So
Ganesh is a strict teacher, okay? Now, see, when I get up in the morning, after my breakfast, I have a list of things to do. That is Ganesh Srotam, Durga Srotam, then Dattatreya Srotam, then also you have Gayatri Mantra, and then Hanuman Chalisiya. So, what is happening is the whole day, but suddenly, after doing it for so many weeks, I am finding that there's a huge difference in my outlook.
exactly.
My mind has changed. I'm not negative about things. I'm very positive. So thank you so much for that, Dr. Ganesh.
Yeah, and I think everyone should do that, and it makes a huge impact in your life, and that we'll discuss step by step. So
Yeah, yeah,
I came out with the 4 different points. There's a mafia of the doctors,
yeah,
their impact on your day-to-day life. That is the
yes,
second topic. Third one is how to get rid of this vicious circle. Okay, and then fourth that is each topic will discuss for 15 minutes, and then the
yeah,
fourth one is uh, how to do how the spiritual life helps to keep doctor away
yeah.
from you. Okay, And the last one, maybe 5-10 minutes we'll spend for question and Q&A
Yeah.
session, right?
Okay. Okay.
So the mafia starts. I think last decade was okay in India, but this Western culture, because I stayed in US, I stayed in UK. UK is a very good because healthcares are almost free in UK, but in US it is a vicious circle set up by you can say this insurance mafia.
Yeah.
So because in US you cannot have a health treatment without insurance,
Mm.
because the expenses are, it will go minimum in 100K range,
Yeah.
and normal person means he cannot afford that.
Yeah.
Even the rich people cannot afford it. Okay,
Yeah.
so here that kind of the business models are now entering into the India, like insurance. Nowadays people talk about insurance, but if you see the last decade, even though I was working in IT field since 2000 to 2010, that decade if you consider, I never had an insurance. We had a company insurance which was a very nominal 1 lakh, 2 lakh rupees of insurance, but that was provided by the company,
Yeah.
okay,
Yeah.
as a part of the salary. But we never had a personal insurance for any
Yeah.
kind of stuff, neither car nor health nor house. But this decade, that is a say 20 to you can say 11 to 20, and now 21 to 30. So it has attained the peak in India, and because of that insurance mafia, everybody started, okay, looting in all the businesses. Now today's part is a healthcare. Now healthcare, what happened? uh, I talked to a couple of doctors and they said we spent our 5 years, 5.5 years, okay, for getting MBBS degree, then another 2 years or 3 years for getting MS degree, and then we have the setup of lakhs. Okay, maybe a dentistry. If you take a dentistry, they say their chair cost is maybe 20 lakhs, 25 lakhs, whatever. Okay, I don't know the exact pricing. So in order to recover that, we have to charge like this. Fair enough, not a problem. But you can recover that cost maybe according to my calculation. If you consider 25 lakhs rupees of chair, you can recover that cost within a year, but it doesn't give you the license to loot patient for throughout the life, right? And they are looting for throughout the life, okay, but they are giving justification that they are spending money in x-ray machine or maybe the chair or whatever equipments are there. So my analysis is if you go to dispensary, you don't have all kind of this you can say the equipments, x-rays, MRI, sonography. These are always available in the hospitals, right? The individual practitioner, they don't buy this such of equipment, and that's why their statements are wrong. It is not a correct statement. Hospitals can afford that, and in hospitals uh, uh, they can recover that cost, I believe, in a 1 year. But they are looting the people for throughout the life, and that's why I call it as a mafia rather than the healthcare. So it is a healthcare mafia. This is a small definition. A lot of details are there, but our time limitation is there, so we cannot go in details of that. Now the first job of this mafia, okay, is to make you the patient first, and they will make you the patient. I will give my own examples, real life examples, and then audience can learn from it. Okay, any question is there? No, Minaji, you are not
No.
audible.
No. No. There's
Oh,
no
okay,
question.
okay. So what is happening? Uh, these people, by some means, they want to extract money
Yeah.
out of the patient, okay, and not a normal money, huge amount of money. So the strategies are, if you go to hospitals, they will ask you, do you have the insurance first? They won't bother about your problem or healthcare problem, whatever problem you have, whatever disease you have, they are not bothered. The very first question in most of the hospitals, they will ask you, do you have the insurance? And then they will do all the calculations
Based
according to
on
your
that.
insurance. Okay, so 10 lakhs insurance or 20 lakhs insurance or term insurance, 1 crore insurance, and accordingly they will say we can give you the AC room, independent room, all these features. Okay. That is a one part of it. In the shop business, you'll see the lot of equipment, ECG equipment, oxygen, and so many high class room. It is not your medication. It is just monitoring your healthcare. but people are getting attracted and they're ready to pay because they're psychologically, you can say, suppressed, or something happened. Uh, I'm not talking about cases like Ganesh Bokhare, who doesn't get attracted by all this kind of the shit. Okay, I call it as a shit. Okay. Second thing is, whenever so the first step is you'll talk to your family doctor, or a local doctor. The local doctor will give the suggestion, go to the pathology lab, get all the reports. That is the second step. Third step is, once they see the report, then they will send you to some big hospital and go through the, again, second level of testing, and some higher level of, you can say, the reports like MRI report, X-ray reports, okay, where you boil down to pay maybe 5,000 rupees to 25,000 rupees. Okay. uh, Nowadays the typical fashion is the blood pressure and sugar. According to me, blood pressure, I have studied anatomy for 2 years. Okay, even though I'm an engineering graduate, okay, I have studied anatomy, and only for this purpose. So your BP and sugar, they have, people have changed the mindset of the these people, means this, you can say, the medical fraternity, I will call it. Okay, doctor fraternity or medical fraternity. They have created a, you can say, the scenario or a model that once you trapped into the sugar and blood pressure, it is a lifetime disease for you. And that is absolutely wrong. That is absolutely wrong, because both the disease are connected to this your mind.
Yeah.
Okay. And I saw the people, they are taking medications for lifetime for BP and sugar. And if any audience is not agree, please, you can ask the questions. Okay. But 99.99%, okay, I'm not talking about Ganesh Bokhare. Okay. And I give the suggestions to my friend. See, madam, I'm not against of this medication, but I'm against of falsified medication provided by the doctors.
Yeah.
And they want you to become a patient for lifetime, so that they can go to Singapore, they can go to Bangkok, and they can eat pizza in the night.
Yeah.
Right?
Yeah. That's exactly what
So,
Divided Streets
yeah,
has said. He
yeah.
said medical agents come and give doctors so much money and throw parties every week in big hotels with liquor, girls, etc. in Andhra.
Right, right. In Hyderabad, I was working in Hyderabad, and there is you can say, the series called Apollo Clinic. Have you heard about it?
Yes, yes.
uh, uh, Once I was working in Think as Semiconductor. We were working on a parallel computing system, okay, for artificial intelligence, and I was a chief architect there. In one particular week, I don't remember the exact. It was a 2015, okay, 2015, almost 7-8 years back. Uh, I was working with my junior, and in that week we worked really very very hard. And once I got I felt a giddiness. So my junior got tensed. Okay, what happened to him? Then he forced me to. He took me to the Apollo clinic. He said, "This is the best hospital in Hyderabad." So we went to hospital. You won't believe it. First, they started with some blood test. Okay, and then typical. They measure my weight, height, blah blah blah, all show up business. And they said, "We'll make 10 tests free." I was so happy. How come such a posh clinic and they're giving 10 blood tests free? Then, okay, let me know the process. Then say you have to become a member by paying 10,000. Then I asked the question, because I am that kind of the person. I asked, how come it is a free? Can you explain me? No, no, this is a membership fees. Means you are giving a different names, basically. They are charging you 10,000, and you do the all testing for no reason. Means you don't have any that. I'm having a giddiness problem. At least you check my pulse.
Yeah.
At least use your stethoscope and check my heartbeats. Okay. At least check my temperature or whatever standard process. They are not doing that. They are going into what you do this test and then become a member and blah blah. Then I realized this is all mafia gang, and this is a story of 2015.
Yeah.
2018. Okay. Why I'm telling this? How to get rid of this using your spiritual healing. Okay, we'll come to that point. Okay, in the next part. Uh, Nobody will believe this, Meenaji. I had a boy. I think one of the session I told you, I had a boil inside. My gums are there
Yeah.
on the back side. Gums are there, and I had a boil in 2018.
Mm.
I went to my this Maheshwar. I told you then couple of weeks I was not available for your session, right? You know that, correct?
Yeah.
One session we had from Maheshwar. I was in ashram, correct? That
Yeah.
time audio quality was
Correct.
not that good. Yeah. Can you believe it? This boil, when I shown it to one specialist in dentist, he
Mm.
said this is a cancer.
Oh.
Yeah, and that is a story of 2018.
Mm.
Okay, then I told my couple of some close friends. Okay, I can't take their names, but uh, 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 they said you have to do something. Then said they recommended you have to cut your this tooth and this bone.
Mm.
Can you imagine what would have happened
My
if they
God.
would have
My
cut
God.
this bone?
Mm. Mm.
Okay, my face would have, I think,
Changed.
might have destroyed. Right?
Yeah. Mm.
I said I will leave to the God, and
Mm.
whatever I did, whatever austerity I did, this is gone.
Mm.
Nothing is there. Can you believe it?
Mm.
This is a spiritual healing.
Mm.
But it took almost 4 years. That practice of, you can say, my spiritual practices. I'm not discussing it. I'm a bit reluctant to discuss because sometimes people don't like it or they don't believe it. Okay. But this is a fact I'm telling you. Okay. Now, the third fact, which I have shown you the last time as well, my eye reports. Okay.
Yes.
I went to a ophthalmologist, and then she said, I was facing a blurring problem to my right eye, this side.
Yeah. Same thing.
And yeah, and then I think everybody knows the story, correct?
Yeah.
The
Yeah.
step one, I went to ophthalmologist, and she said the operation will charge you 90,000 rupees. Then I asked the second question, one eye or two eye? Then she said, no, it is a one eye. You make it clear, no, 90,000 for one eye. Why are you not telling? Once, because they want to grab the patient and they want to make you the patient. First
Yeah.
thing, the doctor's
Once
motive
they catch
nowadays,
you. Yeah. Once they catch you.
and they want to make you patient mentally,
Mm.
and you become a patient. That is
Mm.
your problem.
Mm.
Correct? Your means the people's problem. Okay.
Mm.
So then I went for the second opinion
Mm.
that the cost of operation came down by almost 20 to 30,000 rupees.
Mm.
Another doctor with
Mm.
4 kilometer distance in
Yeah.
Pune only.
Yeah.
Then she asked me to go over the reports, blood reports,
Mm.
and ECG. So in ECG, there is a one point called T inversion. So I was facing T inversion problem. And then she asked me, no, now you go to MD Medicine to get a fitness certificate for your cataract operation for both eyes. Okay. So I went to there is a one Ratna Memorial close to my house. There is a Ratna Memorial Hospital is there. Now I'm having some heart problem. So what are the basic things? A non-doctor person who doesn't have any medical background, he will at least expect she will check my pulse because pulse is related to your heart,
Mm.
right? She will check the heartbeats. She will check she would check the blood pressure. These are the three standard things, right? She saw my report, charged me 1,000 rupees immediately for 5 minutes, and then she said, "You had already 2 heart attacks." I was laughing. And she was trying to show me like a tense person. She is caring so much for me.
Mm.
Why she should care for me? I'm nobody
Mm.
for her,
Mm.
right? She saw me first time. I saw her first time. Okay, and then she said, we are having one Joshi hospital here. Okay, in Pune. Okay, you go there and do the TMT test or treadmill test. Some stress test is there, and then 2D echo for my heart. I took all the reports, came home. I took a cold water bath for say half an hour, and then I did my chanting. You won't believe it. Within the 1 week, my blur has gone. See, now the moral of the story is this. This may not be applicable to all the people, but here the crux of the point is. She said, the doctor said, you already had 2 heart attacks. I told her, I never realized it. And I was just pulling her leg because I was totally pissed off.
Yeah.
Now people will say, I'm getting angry. No, I'm not getting angry. I can't tolerate such type of nonsense. See, if you are getting angry is not a bad, but there is some reason. Or you can call it as angry as well. It is okay for me. Okay, I got an angry, but why are you doing such type of things? And see, people like me may afford. 90,000 rupees for operation. I was ready, almost ready, because I wanted to get rid of my spec. She said, if you put the lens, you can get rid of the spec. And that's why I become a ready for that cataract operation. Then I decided, I left it on the God. And I requested God, instead of giving 90,000, means 1.8 lakhs, okay, to a doctor, I will prefer you give my this money to some needy person. But you become my doctor. Within a 7 days, my blur has gone. Now you call it as a miracle, you call it as anything. I don't care. But I'm requesting all the audience, if you do your spiritual practices every day, your 90% disease will get cured automatically, because it will keep your mind very cool. It will keep your health internally very cool, because once your mind gets affected, lot of you can say the hormones are generated, even if you
Yeah.
get angry, even if you get tense, okay, and that will stabilize your body, and
Yeah.
most of the disease won't happen.
Yeah.
Okay,
So
so
here, actually, Dina is saying, I'd taken
yeah,
my husband to a hospital for knee pain. They put me on another doctor without checking. He said, please admit him as he needs knee surgery. We just walked out of the hospital. Then another person says, Badar Srini says, I live in the USA and spent 15,000 for plus for a frozen shoulder treatment. And it took 2 years of suffering because of our medical system. And another person, Neelam, says, I was diagnosed with bladder stones many years back. So my hospital bed was booked for surgery. But my father in law took me to a homeopathic doctor who cured me in the course of 1 year. Similarly, I had palatial cyst for which I was referred to surgery, but again, homeopathy saved me. So these are all so many cases.
exactly. And nowadays, if you come to IT field, okay, you'll find almost 70-80% people are going through the blood pressure and sugar problems.
Yes.
Okay, and uh, I do agree these are the problems, but these are not lifetime problem. They have simply hypnotized your mind, or they have simply you can say
See,
impressed on your mind.
Dr. Ganesh, let me just tell the viewers one small point. See, when you enter the hospital, you are already in a certain mood. Just like, when you go
Right,
to the airport, you're
right,
already geared for hearing something bad. Okay. So you go to the doctor will refer you to another doctor, and
right,
so on. Okay. If you're not intelligent and you're not looking up all this, if you're coming from a village, you don't know. So what happens is you become very, very susceptible for all this. So at every stage, you will undergo the tests that they prescribe, and by the end of the day, when you leave the hospital, you would have spent at least 2 to 3 lakhs on all these tests. So this is what they're doing. And then somebody, who was an insider, told me that, ma'am, they're getting very expensive machines, and it takes a lot of money to maintain them. So they try to get it out of the patients, gullible patients who fall prey to it. So this is all, as Dr. Ganesh said, a huge mafia working against the people.
right. Uh, so my request to all the audience is, I'm not absolutely against of this treatment, but if they are enforcing this treatment for lifetime, okay, that is wrong. And they want it because, see, here the mafia of doctors or healthcare, which involves doctors, which involves hospitals, and which it involves pharmaceutical companies as well. Okay, all the three are involved, and obviously all these three will get supported by the political leaders as well, because the pharmaceutical company, you need all the licenses, and they will come through the political connections.
See,
Okay, I don't
also,
want to get
doctor,
into that.
yeah, also, doctor, see, when we were young, see, there was only one doctor we used to go to who would give us one
Exactly.
pill and everything would be okay. And every
Right.
time we went to him, he would say, forget about it. Tomorrow, day after, it will be okay. So we trusted in him and our parents, like God. At that time,
Right.
we never had any problems.
Exactly. Because, see, that time our immunity system was also good, and our mind was in a different area. Doctor was just a temporary thing in our life, but nowadays
Yes.
a doctor is everything in our life.
Yeah.
It becomes an integral part of your life. Every small thing happens, you go to doctor, and then doctor will say, initially you do all the blood test, okay, around 10 blood tests before the meal, some blood test after the meal or before the breakfast, after so many types are there. And what is the contribution of the doctor? No, they will simply force you to go through the lot of medical tests. Okay,
No,
and
see, in my case, she frightened me. She said that, see, by any chance, if you get a heart attack now, you better get your MRI done. My husband is looking at me and I'm looking at him. Let's run out of this hospital. That's all, is what she thought.
uh, 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 the, I don't know what to say about this point, but see, we can't get rid of these people or a system, at least at this point of time. We don't have a solution, but there is a way out of this, and that is the spiritual practices. So if you do the spiritual practices, for example, in our last so many episodes, whatever may be our topics, we have connected to the spiritual aspect, right? So
Absolutely.
your healthcare is also connected to your mind, and mind is connected to spirituality. So if
Yes.
you do the daily spiritual practices, for example, I told you, chant Ganpati Sutra, Durga Sutra, and Datta Sutra.
Dattatreya.
Datta Sutra is so effective. You can't imagine the power of Datta Sutra. Believe me, if you complete 25,000, you believe me, your most of the disease will be gone. Or even if you'll go through the now even I go see I'm doing practices for last 25 years, but sometimes I face the problem because of my karma. Some past karmas would be there, or sometime I might be making mistakes, okay, in my life as well, which I may not realize. Maybe indirectly I'm hurting someone or whatever is happening. So I suffer, but I don't suffer too much. That
So
is a
here,
magic of yoga.
one small incident. Let me tell Doctor Ganesh. See, about a few years back, I had a problem in my eye, and I don't know. It just came suddenly, and I could not see, and my eyes were really swollen. I went and saw the same doctor, and
Mm,
that time doctor was not greedy, so he did all the
mm,
tests, and he, he was kind enough to suggest some medicines and all that. But he also warned me that patients who come with this kind of disease become blind. Okay,
okay.
so I was so scared. By the time I went home, I called my guru, Swami Nityananda, and I said, Swamiji, they are saying this about my eye. Can you do something for me? And you know what Swamiji said? In a second. Okay, and within a second, after a few whatever happened, suddenly I don't know, because I don't know if there's some change. The next day when I went and saw the eye doctor, he's saying it has been arrested. What happened in this period when something has happened. Now it is not as serious as it looks. Within a month I was completely cured. As you say, see, spirituality has a very very big role in treating us. When our mind is clear and we are chanting mantras, it changes. So this is something I absolutely believe in what you're saying, Dr. Ganesh.
Right. Now, I will explain how it impacts. Okay, means the naturally the people or audience will ask the question. Okay, means chanting mantra and all that, but how it does the job of healing, right? That is again a question. So it happens at, you can say, the quantum physics level. It happens at vibration level. Whenever you chant any mantra or any stotra, okay, like Hanuman Chalisa or Datta Sutra or Ganpati Sutra or any mantra, okay, uh, uh, it creates, it is like a vibrations. Since I'm an electronics engineer, I have done signals and system, I work in antenna system, I can imagine vibrations, electromagnetic waves and all this stuff. But or even if you consider sound, it has a vibration, okay. So the frequencies are from 20 hertz to 20 kilohertz. If you chant the omkar, om, if you see, okay. Now, I think one European laboratory, I don't remember exactly. Even tigers and lions, when they roar, oh, so the sound is close to omkar,
Okay,
om.
okay.
Yes. So just imagine the power of omkar.
As in the sound of the sun.
Right. So whenever you chant this, it impacts, that vibration impacts at cellular level, cells of your RBC, WBC, and all that. And see, normally, as per the Ayurveda, Vata, Pitta, and Kapha, these three entities, if there is an imbalance, it creates a disease inside your body. correct? Or if you go to the allopathic level, RBC, WBC, or your cells, blood, if there is a, you can say, contamination, okay, in the blood, or if your blood pressure is not good, or your sugar level is not good, and calcium level is not good, it will create a disease inside your body. Whenever you chant the this, you can say mantras or stotras, okay, it balance it. Okay, so whatever imbalance is created because of some reason, food or whatever, okay, your mental pressure or whatever, it creates that balance and it gives a soothing effect. So whenever you take medication, what happens? You are pouring poison inside your blood. Whenever you take any medication, right? It is a drug. They are drugs, okay, and all the liquid medication, 30% or 28% is alcohol, right? And rest of the stuffs are
Here,
nothing but the
one
poisons only.
doubt, yeah, one doubt, doctor. See,
Right.
when you say, listen to mantras,
Yeah.
when we listen to mantras, and what is the difference between listening to mantras and chanting along with them?
It's an impact. If you are listening it, correct, it is not happening inside. Okay, you are listening with your ears, but when you are listening, a lot of noise is also going. Okay,
Yeah, yeah,
and
yeah.
it is happening outside.
Mm.
But as I said, if you want an impact on your cellular level, quantum physics level,
Mm.
okay, so every you can say every blood drop, or you can say the cells, much microscopic level, if you want to make an impact, okay, if you chant it, then that will be much faster rather than
Okay.
listening.
So,
Listening,
which,
you may not listen it carefully.
yeah,
Your
which means,
concentration may not be 100%, but when
so
you
which
chant it,
means,
it goes inside. That
yeah,
is the difference.
which means viewers, when you go to YouTube, take the actual words, when the mantra comes, so that you can chant along with it. In Ganesh Rota or Durga Sata, it's all there. So just chant along with it, and it will become by heart.
Right. Now here I will highlight 2 points: chanting mantra and chanting nam. Okay, you have there are separate rules of it. For chanting nam, okay, take one name, like people say Ram, okay, or people say Krishna. Some people say Radhe Radhe, right?
Shiva, yeah.
There are various people, they love their own gods, right? Chanting Nam, you can do it 24 cross 7
Mm.
and anywhere and
Yeah.
anywhere.
Mm.
But chanting mantra, you have to take a posture.
Yeah.
You have to take a posture. Your ambience should be sufficiently clean,
Peaceful.
okay,
Peaceful.
and you
Yeah.
have to maintain that dignity of the ambience. Okay, you cannot do it anywhere. Okay, and your externally as well as internally should be clean.
Mm.
Okay. So when, because people, what happens sometimes, they start chanting mantra in not a good ambience, or sometimes the vibrations are not good. Okay. So chanting mantra, you have to do it typically in one particular area of your house or place, temple, whatever. And then you have to practice it regularly at that place.
Yeah.
So that creates a aura of that
All over
vibration.
there.
Okay. But if you are not in that position, then you chant the Nam. And Nam is a great thing because there is no negative impact. In mantras, you may get a negative impact if your ambience, or if you are not pure, okay, or purified. So I will say, normally keep chanting the Nam, but whenever you get a time, evening time or morning time, nobody is disturbing you, that time you chant your mantra. And both will do the spiritual healing, but you have to have the patience. I will say, I will I'm always happy to avoid a doctor. I don't want to go to doctor. The previously, the means 1 decade back, story was different. Nowadays it is a 99%, it is a looting business,
Yeah.
and they will make you patient
What?
for lifetime.
Yeah, yeah, doctor. Just one small interruption.
Yeah.
See, friends, you will notice that in certain cities they actually spray, something that makes you get a virus. Okay, and that is why when the seasons are changing, almost everyone is sick in every house, and they end up going to the hospital. And people say that, see, everybody has the same the same what you call symptoms. So this is something they are doing, similar to what COVID has done. They had done it earlier to us, but nobody detected it. Yeah, back to you.
So for such type of cases, there is a best solution is do the havan at home.
Yeah.
If you do the havan,
Mm.
okay, So it is a simple process. Don't make it complicated. Make it a simple. You'll get a Havan Kund, uh, copper Havan Kund in market. Okay, and then in Marathi we call the gobar. You can say that cake, gobar cake. Okay, but try to use it from cow, not from buffaloes.
Mm,
Okay,
mm, mm.
so nowadays it is very difficult to discriminate. Okay,
Yeah.
but that and pure ghee. If you do the 108, take one mala and just use a the camphor.
Yes.
Okay, put some ghee on that gobar. Okay, make a small pieces, put it there, and or put pure ghee on it, cow ghee, and then for chant a mantra and put one drop.
Mm,
Okay, and you have to say Om Swaha. Take any mantra. For example, Om Gam Ganpate Nama Om
mm,
Swaha. The moment you will say Om Swaha, you
mm,
put the drop in that
mm,
ahuti. Okay, first you
mm,
fire it. Okay, using camphor. Okay, and then keep doing and say 108 times.
mm,
Your house will get clean within 1 week.
mm.
And whatever you are saying, these all COVID and blah blah
Yeah,
blah,
yeah,
blah,
yeah.
nobody will
We
touch
will,
you.
we will, we will try doing that. Yes.
Nobody will touch you. And
Mm,
I have done it for so many years.
mm.
I never faced such type of problem. Even in the COVID time, I was roaming around Himalaya and Narmada Bank and everywhere. I was not scared of COVID.
So
And without mask,
you get this dried cow dung through Amazon. Is that
yes.
also okay?
Okay, means now see we are helpless there. Now we
Mm,
in cities getting such type of things. In Pune is like a spiritual city previously,
mm,
today also, but there are some places you get such type of authentic
mm,
stuff as well. Okay, in normal shop,
mm, mm,
but sometimes it is not possible. Okay,
mm,
then okay you can buy it from the Amazon as well.
mm,
But that is not important. See, once
mm.
your faith is there, you
Yeah, yeah.
see something is not in your hand. No, you leave it on
Exactly.
God. You leave it on God.
Mm.
Okay, this is what I can do. But if you do this
And what
Havan,
is the mantra that you say?
any mantra, but I will give three mantras. Om Gam Ganpate Nama, because it is a god of brain. Okay,
Mm,
everything. Second one is a god of Shakti, which is Om Dum Durgaya Nama. Okay, means
mm.
you have to chant a mantra Om Dum Durgaya Nama and Om Swaha. Om
Yeah.
Swaha means put a drop on. Okay, ahuti. Sometimes you can til ko मुझे I don't know the English word for til.
Sesame. Sesame.
Okay, yeah, and rice.
Yeah.
Okay,
Uh,
you just mix it,
mm,
put a ghee on it, and that ahuti also you can give.
yeah.
Okay,
Okay. Oh,
and
without cow dung.
no, the base will be always a cow gobar is
Gobar.
there. Okay, because that is required for fire. No,
So you're
okay,
talking about gobar, you're talking about til, you're talking about little bit of
no,
rice.
gobar is the base. Okay, put a
Yeah.
camphor,
On that
put
you put
oil,
this.
and fire it,
Ah,
fire it,
ah,
and
ah.
now you have to give the ahuti. So
Yeah.
you have to
Yeah.
give the ahuti of ghee,
Mm,
okay, cow
mm.
ghee, and sometimes you can use a til and rice. Just mix it in this your cow ghee,
Yeah.
and
Yeah.
that also you can give.
Yeah. Yeah.
So three different types of ahuti. One is a
Yeah.
ghee, and second one is a ghee mixed with rice and til,
Mm,
right?
mm,
Okay, and you do it for 1 week,
mm.
and you see the magic in your house.
Yeah.
I never explained all this stuff in our previous episode because see means my understanding is people will understand it step by step. If I will try to explain everything in first one episode, people may not able to conceive it. But right now, the people started understanding whatever audience we have. Correct? People started understanding, and see, I don't have any personal benefit. Okay, I'm not a doctor. I'm a doctor, but not a health doctor. Okay, so I don't have any benefits, but you can minimize your problems by 99%. Believe me, 99%.
So how do we do it here in the West?
In West also, a lot of Indian shops are there. In America, I used to always see the Gandhi shop, Gandhi Nagar. Okay, that is a people give that means Gujarati community where stay.
So
So in that shop, you'll get everything.
he's saying you can't put a fire in the house.
Oh yeah, I got it. Yeah, because the fire sensors are
Yeah,
there.
yeah,
Yeah,
yeah, yeah.
you can. I think you put a. I think you can cover that fire sensor, but don't make it quite huge, make it very small. Okay. Or another, if that is a problem, you do one thing. You get that uh, one pot is there with handle. Okay. हम लोग धुपाटने बोलते हैं उसको
Mm,
मराठी में.
mm.
uh, I don't know the English word for that.
Yeah, yeah,
Huh.
yeah, yeah,
And you can just put camphor. Suppose if you cannot do it, and if you don't get a time, so you
mm,
do one thing. Just put a camphor in that
yeah,
and burn the camphor
mm,
inside your room. That is also more than sufficient.
mm, mm.
But then you sit in posture, some good
Mm.
posture for the people who are staying in America or UK having such a problem. So you can do one thing, you just burn the camphor. That is also more than sufficient. But then you have to take a posture, beside one room, okay, whatever
Mm,
comfortable room is there, uh, and sit there and at least chant name for
mm,
30 to 40 minutes. 30 to 60 means 1 hour, half an hour to 1 hour. That will create a huge change inside your body. So you don't have to visit a doctor. And by chance, because of your previous karma, if you come across any disease, okay, your body is a 99% it will cure automatically. But you have to have the patience. But nowadays, what happens? People get even a small disease, fever, and all this stuff, they will go to doctor. And convincing such type of people, especially the parents, uh, uh, if they feel their kids are having problem, they go haywire mentally,
yeah, yeah.
and that's the whole problem. Yeah, so they will take the kids to the doctor, but it is not required, believe me. But see, I'll say in emergency you go to doctor. I'm not against of that. Okay, but if you do this every day, 99% you don't have to go to doctor. Yeah.
Yeah. So,
Uh, I think last 10 minutes are there, so if, I can take the questions from audience.
yeah. So Dr. Shreyasta says, Dr. Ganesh is right. It's hard to find trusted and good people in this field. She's talking about this field. It's good to have a yantra at home.
Yes, that is also one of the technique. Basically, all this creates a good vibrations, and
Yes, yes.
vibration makes a very huge impact on your body. Body means I'm saying it is at cellular level, microscopic level.
See, in
Right?
2012, my thyroid was little high. I was told I needed medicine for the rest of my life. I questioned the doctor if it is medicine. Why will it not cure me? And why should I take it? He had no answer. Here, in this concern, Dr. Ganesh,
Mm,
see, I was just speaking to Shreyasta about it also. And Shreyasta was saying that, see, there are certain natural oils, like lavender and all, which they find in Germany, which are
mm,
very good for this. And also, she said that, see, if you take moringa,
mm,
moringa, which is available anywhere for us, if you take moringa powder, that is
mm.
very good for thyroid, and
Right,
for eyes. See, these are all very good. It's just, you can pick it up and just powder it and take it. Otherwise, take it in capsule form, you know. So these are things that are there in your garden and which you can, just have. So many
right.
things, yeah. And it can control your thyroid.
Another best medicine I will give, which is a spiritual medicine, Tulsi.
Yes, yes.
Every day eat Allah at least 20 to 25 Tulsi patra बोलते हैं ना, तुलसी के
Okay,
पेड़,
okay.
ये आपके घर के हाथ. It is a free,
Mm,
correct? It is a
mm.
free. And if Tulsi is there, normally if Tulsi is there, it is a you can say the boon given by Lord Vishnu or Krishna.
Yes, yes.
My existence will be always there.
Tell
You
me
know the
something,
Tulsi,
doctor.
you
You
know the
have
story of
you have
Tulsi.
like a Ram Tulsi or a Sita Tulsi. You have different Tulsis. How do you differentiate that?
I don't have much knowledge about it.
So anyway, some Tulsi is good.
Yeah, green. I have seen green and sometime it is slightly black,
Mm,
slightly black. Okay, both are good.
mm,
Both are media. Huh? But the leaves normally wash it. Okay,
mm,
and then eat 20 to 25 leaf,
mm,
or you can put it inside your food as well.
mm,
Whenever you cook a rice, no,
mm,
put tulsi leaf around 5 to 10 leaf. uh, Everything will get purified. Actually, Tulsi was a Runda. Her name was Runda, and Runda was a you can say Jalandhar's wife. Jalandhar called Rakshas. Okay,
mm,
and then people tried. He defeated almost all the gods,
mm,
and then Runda was his wife, and she was so spiritually advanced, and she used to worship Narayan, means
Mm,
Vishnu. Okay, so the gods were not in position to defeat Jalandhar,
mm,
but then Lord Vishnu uh, did something because she was a sati. Okay, so if you want to kill Jalandhar, then her you can say the dignity should get contaminated,
mm.
and then Vishnu take the form of the Jalandhar, and then actually uh, she was a deity of Vishnu only. Okay, but because of her previous karma, she has to marry the Jalandhar. That was a problem. So uh,
And also,
so
what I heard was that, see, if you have a tulsi in your garden, even the just the area around it is
yeah,
so full of
vibrant. Right,
vibrations,
right.
that can charge you up, positively.
So then Jalandhar gets killed, and then Tulsi Runda come to know कि because of Vishnu he got killed because he deceived me, and then Krishna become the she curse Krishna, and Krishna become a stone which is called Shaligram.
Yeah.
Okay, so we worship the Shaligrama. So then Krishna give her the boon uh, uh, that you will always remain in my कंठस्थ. तो तुलसी की जो हम लोग सत्यनारायण पूजा में 1,000 तुलसी पत्र छोड़ते, that is the reason for that. So so that so she's like highly pure, and that will purify your body as well.
Yeah.
Okay. So when you're so then her name, so तुलसी विवाह आता है
Mm,
दिवाली के बाद एक
mm,
which is called Dev Deepavali in Maharashtra. In other states I don't know. So there is a
yeah.
Tulsi Vivaha is also there. There is a movie called there are Maharashtrian heroine is there, Jayashree Gadkar. Okay, she was a
Famous,
mother of
very
Ram
famous
in
actress.
Ramayana.
Yeah, yeah,
Yeah, she was the mother of Ram in Ramayana series as well. So uh, she has acted in that movie and the Jalandhar and then the war and all that. It means I enjoyed that movie when I was a kid.
yeah.
But
Very
that
good
time I
actress
did
as
not
well.
understand the meaning. But now, yeah, I saw it once again. Yeah. So
Yeah,
you can read. You can
yeah,
read that story.
yeah.
Yeah, I think we can take the
Absolutely.
questions from
Yeah,
audience.
I think, yeah, people are, just 1 second. So, yeah, uh, doesn't Italian food use lots of herbs, including basil, which is tulsi?
Yeah, Basil. Yeah.
Yeah. So, tulsi is a form of basil. What is the scientific name if somebody knows it? That's what we put on pizza.
Yeah. And one more thing, if you want to keep yourself healthy, eat good breakfast in the morning. Okay, whatever breakfast you eat, make it 50% as your lunch. Means suppose if you eat say two parathas, so make one paratha for
Okay.
lunch. Eat two parathas. Eat more in the morning. Eat 50% of breakfast in as a lunch, and try to avoid your dinner. But some people may not, they cannot because some people are doing exercise, a lot of work and all this stuff. Then try to finish your dinner by 6 or 7. But eat 50% of your lunch.
Mm,
Eat 50% of. This is a simple rule. Okay. So you can keep your lot of disease away from stomach. See,
mm,
sugar problem and a BP problem is your mental problem. And the second cause of all disease is your stomach.
mm,
Okay, if you cannot digest the food properly, you'll get other
mm,
problems. Correct. So if you follow this basic rule, okay,
mm,
of your food, don't eat anything after 8 o'clock.
mm,
In special, say, don't make it hard and there is no hard and fast rule. Sometimes you go for a party and if you eat, it is okay, not a
mm,
problem.
mm.
But that is a once in a blue moon. But
Yeah.
normally try to avoid it.
Mm.
Okay, and try
So,
to finish
Zoya,
your yeah.
yeah. Zoya is saying the fleshy
Hmm.
part below the thumb, that area represents the thyroid. Press it as much as you can every day. It will greatly help. Just sharing, as this is a tip given to me at the Ayurvedic center.
Yes, this is called acupressure, and it also works because we are having the energy points. So you can
So
do the mudras as well.
you're talking about the fleshy part means just below the thumb.
Right, right. But you can do the mudras as well. These are
Yeah,
called Panchamahabhutas.
yeah,
Okay, so your thumb is a fire, and these are the this one is a air, this one is Akash, this one is a you can say your Prithvi, and this one is a Jala. So you can balance your pancha tattva in your body by doing mudras. Normally, I do the Vayu mudra. This is a Vayu mudra.
Yeah.
Okay. So if you touch base of your thumb, it will reduce it. If you touch tip of your thumb, it will increase it. So this is a mudra good for your concentration or your you can say meditation. One more thing. If you are having a severe headache or if you cannot focus, you do one thing. Take these two fingers and close your ears, something like this. Okay, absolute no sound. Okay, then you'll listen to only inner sound. You'll automatically get inner sound. Just anybody can try right now as well. So just take this and this external part is just press it. So close your ear. Don't put it inside this part of your ear. Just put it on this and close the door of here and just press it and you'll see the absolute silence. You'll get focus immediately within 10 seconds.
Okay.
It's this is for the people who cannot do the meditation because of some lot of thought process. So start with this. But it is difficult to hold like this for 5 minutes or 10 minutes. But at least if you start with this, okay.
What is it good for?
For meditation.
What? Meditation.
This for meditation. Those who cannot focus, cannot concentrate, having a lot of headache, okay, or a lot of imbalance of mind is not stable, do this. Close your eyes and close the ear. No absolute zero sound, and then automatically you will hear the inner sound. Okay, and that I will give the homework. You figure it out. What is that sound? See, now I'm telling you a lot of secrets. Okay,
so I think our time is also over by now.
Yeah, if there is any last one or two question, we can take it and then we can close.
I'm just looking. I think I used to do yantra trataka almost every day. I like the Shiva and Kali yantra Shri. Yantra is very powerful. So these are just comments.
Yeah.
So I think with this, doctor, we can end this session and we will meet next Saturday with another topic, because anything that you discuss with Dr. Ganesh is very interesting and brings about a lot of chats. Thank you so much.
Thank you.
Good night.
Have a good night. Yeah, have a good day.
Good night.